please remember to take time now to like, share, and comment on this broadcast for others who may need to subscribe to our social media, follow us on YouTube, Facebook, Twitter, Instagram, and all those favorite social media links. Keep on coming up next month, Mr. Fahmy, we'll be starting our next entrepreneur class. That's going to be starting on May 31st, so you got plenty of time to get signed up. We will be doing virtual classes and in-house classes. Okay, so for those who can't make it in-house, you can sign up and take the virtual class. So tonight, ladies and gentlemen, we got a special guest in our studio tonight. We got Miss Pamela Thompson with the North Alabama Sickle Cell Foundation. Miss Thompson, welcome. So Miss Thompson, I'm sorry, talk to us a little bit about sickle cell.
Okay. Sickle cell is an inherited red blood condition that you can only get from your parents. You're born with sickle cell disease. You don't just get it by touching, looking at someone, or sitting next to someone. So you're born with sickle cell disease.
Okay. And for the most part, I know our producer, she's got a few things that I want to talk about as well. But how does the disease process work?
Okay. If you have a parent who has, the mother has a sickle cell trait, mm-hmm. and the father has a sickle cell trait, then you have a 25% chance of having a child with sickle cell disease.
Mm-hmm.
For instance, if your one parent has sickle cell disease and the other parent has sickle cell trait, then you have a 50% chance of your child being born with sickle cell disease.
Okay.
So that's how it works. It's hereditary, you're born with it. And that's the part that we really need to emphasize to people, because I hear it every day from individuals living with sickle cell disease. They say, well, I was diagnosed when I was 3 months old. I was diagnosed when I was a year old. I was diagnosed when I was 5. But the problem is this. It used to be that sickle cell was not one of the tests that newborns were given. So in the state of Alabama, one of the first states to do it, started in 1988, testing every newborn for sickle cell. So if you were born in 1988 and beyond, you're supposed to know your status. And if you were born with sickle cell disease or sickle cell trait, the North Alabama Community Foundation will receive a report from the State Department of Health to let us know these newborns were born in the 10 counties you serve. Please contact the parents for a conference about their child. So we send letters out and say to the parents, we would like for you to come in to talk with us. We've received a report from the state, and we will not tell you in your letter or even in your conversation by phone what your state report said. So this is what I try to tell many parents, because parents get very excited about their baby. And everybody's like, what's wrong with my baby? And so to ease some of the tension, I say to parents, if your child had sickle cell disease, you will know before you leave the hospital. They will give you all of the information. Your child will be placed on penicillin, and then they will do further tests within the next 6 months or 6 weeks, whichever one you prefer to have. And then from that, it will tell you specifically if your child has the trait or has the disease, if you have questions about it. But in most cases, when the newborns are born and that test is given, and most of those tests are accurate, it will tell you then that your child has sickle cell disease or your child has sickle cell trait. So we at the North Alabama Sickle Cell Foundation office counsel parents. We counsel both trait and disease. And what we're trying to do is get the parents more aware of what's happening with your child. If you have the trait, we want you to keep it in front of your child at all times. Baby, you have the trait. So if you ever decide to get married or date a lady or whoever, then you need to ask them, do you know what your sickle cell status is? And if they say, I don't know, well, what we can do with the state, if you were born, like I said, after 1988, we can submit your name to the state, and they will send back a report. And if they can't, for some reason, find your report, or you were born out of state, but you live in Alabama now, we will do a blood draw in our office, and we will send that sample to the Comprehensive Sickle Cell Center at the University of South Alabama in Mobile. They will do a complete analysis of your blood and send the results back to us. And then we'll call you in for counseling as it relates to what the test showed. So as adults, we've had several young couples to come in. They wanted to be tested. They didn't know their status before they decide to have a child, because you can have a child. It's just that you and I, and no one else knows what the status of the child will be.
Right.
I'm going to give you an example. I had a family. They had, the firstborn was disease, the second was trait, the third was disease, and the fourth baby was normal.
Wow.
So you never know what will happen. You take that chance. We will not tell you, no, don't do that, because God is in charge of what happens.
Right. Right.
Yes.
I know that in a previous conversation that you and I had, I didn't particularly know what my status was, but my wife and I have a son. His name is Joshua, and of course he's in our studio today. And I was totally blown away, because I thought that my bloodline and my family was exempt from something like that. But over the years, to see what the possibilities are, what the child goes through, it's an education that I think that every family, and especially in the African American community, do the statistics mostly lean towards people of color, or it doesn't matter?
Well, it's more, we would say Black or African Americans with the trait within our system. But lately, Latinos, they have it. And it's not, you're not exempt. No one is exempt. We have Asians, Indians, Caucasians, but it's rare. But it's in all races.
Okay. Right. So you mentioned a date, a year, 1988.
Yes.
So the state of Alabama started in 1988,
Yes.
testing all children.
Yes, for sickle cell disease and sickle cell trait.
I think I missed that memo, actually. But that's a good thing. And that's how we found out when our son was born. He was born, he had jaundice. The jaundice was prevalent for several days. They said, let's make sure he gets a lot of sunlight. The jaundice will go away, and the jaundice persisted. And then the results came back, and they gave us the news that he had sickle cell, SCD, sickle cell disease. I think it's there are different levels. I guess there's an S, and that's when he has. But I tell you, in educating your children is very important.
Yes.
It's very important that they know, and that's why he's here tonight, so he can listen. I think my aunt is out there. She's watching, Joyce. She's watching us also, and she's a child with SCD.
Okay.
And unfortunately,
outside the state of Alabama.
And she was born, I think, in California, if I'm not mistaken. Please correct me, Auntie. But during that time, she was around my age, pretty close. The technology and efforts were not as they have been recently. There's all types of potentials that are out there. I've even heard that they're looking into using something from the AIDS virus to potentially.
Well, the drug hydroxyurea was first used to treat cancer patients.
Oh.
And that particular drug has proven to be very successful with our sickle cell clients.
Wow.
So that's why a lot of people want to associate it with cancer, but it has absolutely nothing to do with cancer.
Right.
But it's treating them. And when we talk to parents, especially once they put their children on hydroxyurea, the hospital stays almost in the night crisis. Everything just sort of levels out.
Wow.
And so it's been a miracle drug for many of our clients. I've run across a few who say to me, it just really made me sick. I could not take it. So they came off of it. But for those that are on it, they're doing extremely well.
Wow. That's great. Great.
Wow. Folks, those out there who are viewing, please, if you have any questions
for Ms. Thompson that that you may have in regards to sickle cell, please don't be afraid to put it in the chat, and she will try to get you an answer the best way that she can. Ms. Thompson, you had mentioned the state of Alabama after 1989. It was y'all started testing. Is that correct?
It started in 1988.
No, 88. Is that across the state, or is that just Alabama?
Alabama started in 88. Now all of the states are now testing.
Okay.
We were a leader in that to get it started, and so now every state is testing for sickle cell. When they do all the other tests that they do for the babies, we draw in the same amount of blood, just run it through that process. So,
Okay.
Now, for adults such as myself, and like Mr. Farley had to find out, if is there a way that we can check if we were born before those years to say, hey, I don't know if I have the trait. That's something that they call and have a family. They should go ahead and get tested for something like that, so they would know and be prepared for something.
yes, and we do the blood draws in our office. And for any couples that come in, we have them come in every now and then and say, we want to be tested. We want to know what our status is. So we're happy to do that locally. And then you can also go to any of the blood centers as parents and get your blood drawn and tell them you want the sickle cell test.
Wow.
So follow up, right? So, Ms. Thompson,
Yes.
the traits. And so this is one of the things that I've been trying to figure out what affects the traits, because just this year I had the VA to check me, and I figured it was already done. And I do have the traits. So do you know anything about the effects of someone who has the traits?
Well, if you have sickle cell trait, in most cases, you have no symptoms of sickle cell at all. Now, this is what we're finding with some of our young people. If they're playing sports and they're out there in the sun and heat, now they may start developing some pain symptoms in their legs and arms, but it could be based on just muscle cramps. But as far as your trait, you should not have any symptoms of sickle cell.
All right. Okay, that's great. That's good to know, because no, sometimes when I think back, I may have been experiencing some things, but anyway, that's good. So along those lines, the programs that you offer within your organization. So can you kind of let us know about some of the programs?
Our foundation is a support organization, and when we say support, we support our clients living with sickle cell disease. Now, many of our clients do not work; they're not able to work. So, of course, they're on various forms of disability. And sometimes there's a situation within the household where that disability check or whatever check they're receiving is not enough to take care of an emergency that has taken place. And many of us know that sometimes the utility bills get outrageous. So we do utility assistance, we do some rental assistance, we do medication assistance, and as our clients get older, we're now doing dental assistance. We have emergency situations where some of our babies are at Children's Hospital in Birmingham for 1, 2, and 3 weeks. The mother is there, sometimes the grandmother's there. They're in a dire financial need, so we go down and we make sure that they have the funds to support them, their activities and whatever while they're there at the hospital. So we do that, and we do emergency medication. We have many of our clients, once you have sickle cell, other things start happening with you. So we got a few with other health ailments, and their medication is very expensive. So we just do what we can to support. And I have a lot of people without transportation. I'm a transporter also. I'll transport you to medical appointments, to the hospitals, even in school the other day.
Right.
So we do transport. We just do services that will help. And that's why we reach out to the community to help us provide these services.
That's excellent. That's excellent. So children who is 18 that, for instance, my son goes to St. Jude. And so I think it's at 18, after that point, he's no longer eligible to go to St. Jude. I think that sounds about right.
Yes. What we have now is the Kirkland Clinic in Birmingham for adults living with sickle cell disease. that particular clinic specializes in adults and help adults move through the process. We don't have a clinic here in Huntsville, but we recommend quite a few of our clients to the hematology centers here, but many choose to go to Birmingham to the Kirkland Clinic because that particular clinic knows all about sickle cell. They know exactly what to do, and they receive their treatments there and they return home. So that's where adults need to go. And so for those adults who have not communicated with us in some time, if they would just communicate with the office, and if they're in need of some services, if they feel that they're lacking, then we will direct them to the Kirkland Clinic in Birmingham.
So this Kirkland Clinic, their primary, I'm assuming they sell everything from Medicaid, Medicare, private insurance.
Yes,
Okay.
yes, they do. And so no sickle cell client is turned down. That's the best part about it.
Okay.
We will not be turned down.
Good. Good.
That is awesome. That is awesome. So I know you mentioned you found a lot of the young students who start to begin to play sports, you're finding that they are with pain and aches. And is that a common symptom that one should look out for if they not been told that they had sickle cell?
But every now and then you will find a child who parents don't realize that their child has sickle cell disease because, again, so many within our area come from other states. They moved into Huntsville.
Right.
And so it's not until late in life that after they go through all of this pain and stuff, no one knows what's going on, and somebody says, what's going on? Now, then this is something that a lot of them will say, well, I didn't get diagnosed until, I didn't know I had it until I was a certain age. You had it, you were born with it. Thank goodness you didn't have the pain and the other symptoms that others had. So, but that happens, that still happens. They find out late in life. And I had a friend, she didn't find out until she was 70 that she had sickle cell disease. She said every now and then she would feel bad, but she would just push it off and keep on going.
70 years old.
Wow.
What a blessing.
And see, it's good and bad. That's what one of my friends said. It's good and bad. He said the good part about it, you didn't get all these drugs in your system all these years.
Right.
And the bad thing about it is because you didn't get some of the medication, everything's deteriorating.
Right.
So it's good and bad in that.
Wow.
But she did, so you can say you can live with it without ever knowing it because you don't have the symptoms that others may have.
You know, earlier you mentioned that, for instance, your organization has covers a certain part of Alabama.
Yes.
So I'm assuming that there's another organization or there are several other organizations?
Yeah, there's a total of 6 community-based organizations in Alabama covering all 67 counties. And here in North Alabama, I cover 10 counties in North Alabama. And so that ranges from the Shoals area, Franklin, Carver, Lauderdale, Lawrence, Limestone, Morgan, Marshall, DeKalb, and Jackson counties. So we cover those counties. And then my Birmingham group is called Central Alabama, so they cover 13 counties. And we have an office in Tuscaloosa, and we have one in Montgomery, one in Mobile, and one in Tuskegee.
Right.
So we cover the entire state.
So are you all supported by the state at all of your governmental organizations?
We're supported by the state under the Education Trust Fund because we provide education. It was under that particular funding. That's from the office and to council. It is not to support the clients.
Right.
All client support comes from fundraisers.
Oh, wow. Yeah.
Wow.
Okay.
So the office that's here in the Huntsville, Alabama area, is it a big office? What is that staffing like?
It's a very small office. It consists of 3 or 4 people, one full-time, and everybody else is part-time. It is because of the funding is so limited, the benefits are not there. So I tell people when you want to work with us, we're hoping that you have some benefits from some other channel because it's more volunteer than anything else.
Right.
So that's how I operate though.
And with that staff, how many people do y'all service here in the Huntsville area?
We have on roll, we have 167 people on roll. Now, in the majority of the clients that we serve, it's going to be constantly serving month to month. It's going to be about 28 that's constant. And then every now and then we'll get one of the ones that they're not having any problems, they're not having any issues. And then they'll come to us and say, I need some assistance with X, Y, and Z.
Right.
But we have some that they're in the hospital once a month. They got to go get blood transfusions at Children's Hospital twice a month. They have to have transportation to get there back and forth. We have a couple that has medication that they cannot pay for. There's not enough to cover it. So those are the kind of situations that come up. We had one. It takes our clients over a year to get disability. If they have been working somewhere and now they're no longer able to work, but it takes over a year to get it. And they are not able to work.
Right.
And so we had one that I just had to bend over backwards to help him survive, paying rent, food, all that, trying to get on disability.
Right.
And they finally okayed it.
Wow.
So it's a process.
That is something. That is something. Again, team, ladies and gentlemen out there in the viewing audience, Ms. Thompson has put out some good information, not only for here in the Huntsville area, but for those where you live at. It might behoove those people who were born at a certain year, if you're planning on having a relationship and having children, get tested and find out if you have that sickle cell trait, and to see if your potential mate may have it, so and have an idea of what you all are getting into as y'all decide to go ahead and make your life and have a family. I think that's very, very important. On average, let me ask you this: do you happen to have the percentage by state where the most personnel are diagnosed with sickle cell?
Well, Alabama is one of the ones with the largest population. California has a large population. Michigan, the state of Michigan's population is large. Ohio. And then when you're up in the New York, Philadelphia area, some in DC, it's where a lot of Blacks are living in certain sections of those states.
Right.
That's where it is. And so, and I didn't look on the website today because all of the sites are on our national webpage, all of the locations of all of the sickle cell centers. And so we're covering most of the states. And Alabama is actually one of the ones with the best coverage. We cover all of our counties. Okay. And in a lot of the states, they only cover certain cities within that state, and that's it. Okay. So we laugh, and Alabama's always supposed to be the last with whatever we're doing.
Right.
We're the first to start testing all newborns. Yes. We cover all 67 of our counties. We are the first to get an automobile tag. Which is a fundraiser for all of us for the state of Alabama. So we're first in many. So we sort of brag on that when we get to the national meeting. And so we work together, all 6 community-based organizations. We work together, and there's a bi-monthly meeting in Montgomery every month so that we'll know what's going on across the state.
Okay, there's a question we have. It says, does the sickle cell trait increase any other health problems, such as blood clots, kidney disease, or more?
The sickle cell trait does not.
Okay.
Now, the sickle cell disease does, but the sickle cell trait does not.
Okay, great. Thank you for that. On your website, not on your website, but in some of your literature that you have in your office, you have one that shows a map of where it started from. Are you familiar with that map that you have?
It started out on the foreign countries of,
my question was, I don't know if I can get the producer. Producer, can you put the map up for me real quick? And I was just curious. So that map is highlighting where a lot of it started from and how it's migrated. I was curious though on the key and some of the names that it lists. It's got Arab, Indian, and and it's got Bansuing and Benin. Can you explain what is it? Benin a country?
It's African.
Was that one of the African countries?
It's got to be because it was basically started within the African countries, and then as people migrated all across
Mhm.
and mixed. So yeah, it does cover a lot of Africa.
Mhm.
And you know, when children get meningitis, that's one of the saviors that saves individuals with sickle cell disease to have that, and it fights that.
Oh,
Wow.
yes, absolutely. You know, I've done because my son had. I've
Thank
done
you,
some. Yeah, I've done some research on my own throughout the years, some readings, and I've heard there that in Africa because they have certain diets, right? And there's a particular root, and I did a lot of reading on it. I forgot the name of the root. It's not yucca, but in that diet, how much it has helped them um, not have the same effects as our children here in the United States have, and they are able to live longer and more normal lives, what's considered normal lives, right? So you mind if I bounce to another question? You mentioned sickle cell tag. What was it?
Oh yes,
Sickle cell tag.
we have a
We have a tag.
slide.
I think you have one of the tags, Kyle. Can you put that up for us,
Yeah.
please?
Wow, sickle cell tag. So oh, okay.
Yes, the tag started 5 years ago as a fundraiser statewide. It was headed up by the now deceased Birmingham sickle cell director, and we were asked to push that tag and get people to buy it. We have to have 1,000 of those tags sold per year to continue the tag. And so we were averaging 1,400 a year when we went and met with the tag people last year.
Okay.
So that tag is now being noticed across the state of Alabama.
Right.
So more people see the tag and they want to purchase the tag. So
Yes.
that tag hopefully will be, we had to go back to the drawing board again on the tag. So we're hoping that tag will be available again in July so
Okay.
that individuals who would like to purchase a tag can do so. We receive $42, I believe it's right at $42 per tag back to us. You pay an additional $50 when you renew your tag. You can personalize your tag on your vehicle. I have currently, this is my third tag that I've gotten. So this particular tag has NASCF standing for North Alabama Sickle Cell Foundation.
Mm.
Have one with my birthday on it, January 19th, for those who want to remember that. And the other one has, I believe it has the AAMUG on it, which means Alabama A&M University grad.
Okay,
So
all right.
you can personalize your tag, whatever you want to have on it. And it's one of the best fundraisers statewide.
Right.
And we receive compensation from the tags monthly.
Yeah, that is great because in fact right now, Bruce, I don't know if you know, and people out there watching who live in Alabama, Alabama is now changing their tags. If you have to get your tags renewed, you have to get the new Alabama tag. And what better time than now to go ahead and switch your tag to one of the sickle cell tags in support of North Alabama's sickle cell organization. We have another question for you. It says, other than genetic disposition, is there anything else that makes one predisposed to sickle cell?
Yeah, genetics. It's a gene. That's the only way you can get sickle cell. You're born with it. It's from the genes.
Okay. And it looks like we have another question. And it says, is it curable?
Well, there is no universal cure. We've had one successful person to do the bone marrow,
Yes.
and he received the bone marrow from his brother. So that was very successful. And we were trying to get trying to think of the other cure, stem cell.
That's right. Stem.
Okay. The stem cell only works if you have a sibling where you have the same mother, the same dad, and the makeup of your stems is almost identical. Otherwise, that does not work.
Right.
So bone marrow seems to be the best source for a
Mhm.
cure, but no universal cure.
Wow.
Now, is that bone marrow from a relative or from anyone?
It should, well, it works better if it's from a relative.
Right.
But every now and then with the bone marrow, you can find a match.
Right.
And you take a chance, like with everything else, to pray that this match will work for you.
Right.
But we've only had one successful case.
Wow.
Right.
Wow.
Yeah. That was another part of our conversation. I've had that looked into for my son, and he does have a sibling that the tests were done that she's a perfect match. Um, but the initial one, when I thought about the part of tearing the body down in order to build it up, in a sense, you have to basically kill what's there in order to put in
Right.
the new cells, and it takes a toll on the child. And recently I talked to St. Jude about it again, because he's doing really well, and he does use the hydroxyurea because he does really well. They do not consider him a prime candidate for that particular procedure. So there are, like I said, there are some potentials that are coming about. The awareness that, team, that you and I that are out there, whether we have children or family members that are experiencing it or not, I think it's a worthwhile cause, because there are many out there that are living with it, like you said, they don't even know it. And because some of the symptoms are almost identical to everyday, and things that happen. And when we go to Google or WebMD, we put in chills, body aches, whatever, and then it tells us, okay, well, it's potentially this. What's the likelihood of SCD going to come up? Now, for one, it's a predominantly African American disease. So, and obviously, it does not get the same attention, period. It doesn't get the same attention that other diseases get. And that's, I think it's one of the group TLC, one of their singers has had it for many, many years. And it's just so much education that's out there. So, we have to continue to bring awareness. I think you have another one.
Okay, we do have another question. It says, is sickle cell and meningitis in the same family?
I don't know, and I would not think that it would be in the same family.
Right.
Okay.
Because you get meningitis from the viruses within, you can get it from the viruses within the environment, but you cannot get sickle cell from the environment.
Right.
Okay.
It's not transmissible.
All right. We have another question from our viewers. It says, what factors make the trait turn into full-blown disease? Are there any steps, such as a diet or exercise, one can take to prevent the trait from becoming the disease?
The trait will never become the disease.
Right.
Okay.
Yeah,
Great. So that's good to know.
Yeah. Oh yeah. When you have your personal experiences, you're absolutely right. It won't. And I that's why those previous questions of, it's oftentimes it takes two. But I guess if you have one parent that has full blown, i.e. my son Joshua, I tell him it is imperative that you know the status and look at the statistics and look at the potential possibilities if you want to have children. And also then you have to go into it in prayer, because it's very likely that that child may end up with SCD.
Right.
What form of SCD, you don't know.
So earlier you had mentioned sickle cell, what is it, Awareness Day?
World Sickle Cell Day.
World Sickle Cell Day happens to be the actual same day as Juneteenth.
Yes.
Okay. So talk to us a little bit about that. What is the purpose of World Sickle Cell Awareness Day?
Okay. On World Sickle Cell Day, all sickle cell organizations across the United States are to celebrate and participate in an activity. And the purpose behind that is to put in the forefront of all of our emergency room personnel, our doctors, all medical professions that sickle cell disease is alive and well, and we need your attention when our clients go to the hospital. They need your attention and they need it now. So it's not something that they're coming in there just playing around with. We want you to be aware that sickle cell disease is here and we need your help.
Right,
Good.
right. You mentioned something about that when our patients come in and they're telling you that they're in pain, and it's not just there because they're trying to get medicine. And there's always that long adage that African Americans, and specifically African American females, have a higher pain tolerance than any other ethnic group, and doctors don't want to give them pain medicine. And I was talking to my daughter-in-law, who was happening to be going to the hospital and being checked out for possible MS. And one of the things that they wanted to give her was some pain medicine, and she said, "No, I don't need it." And I told her, I says, "You're playing into that stereotype that you as an African American female have a higher pain tolerance than any other ethnicity group."
Mhm.
And so therefore they're gonna say, "Well, I tried to give an African young lady some pain medicine. She said she didn't need it." Now I know her reasons why she's saying she didn't need it, but I think that plays into that part when you say, hey, when they come into the hospital, don't think they're here because they need this. They're actually in pain and they need help, you know. So that there is very interesting, very interesting. Events coming up.
Okay. The major fundraiser that we have for the Sickle Cell Foundation is our annual walkathon. And it's scheduled for Saturday, June the 4th, downtown Huntsville. We start at Big Spring Park. Registration starts at 7:30 in the morning. The walk starts at 9. It is a 2-mile walk through historic downtown Huntsville. And it's the best fundraiser that we can come up with.
Great.
And so we've already sent out some materials to get people to form teams. We got a team concept from a 7-year-old client who formed her team the first year I was working with it. And she formed the team, and she got her mother and her mother's co-workers together, and she named her team Ladybugs. And so, of course, she had a couple of men wearing the Ladybug shirts that day, but Ladybug raised $1,400.
Wow.
And so
Awesome.
from that concept, we got a lot of teams formed. And so hopefully we will have about 50 teams if everybody would come together and do their part and help us raise this money to support our clients. We've got another team out of, believe it or not, I tell people, we let the people outside of Madison County beat us all the time. We got a big church group out of Tanner, Alabama, who comes with their church buses and vans loaded, shirts on, and walking and bringing funds with them. So
Wow.
I said to them, it doesn't matter the size of your church. We need your participation. We have another congregation, has 6 members, but they come and they support us. And so anybody wanting to form a team, just contact our office. We'll get your team package together. And on Saturday morning, June 4th, we look forward to seeing as many of you as possible. We would love to have at least 1,000 walkers out there Saturday morning, just saying we're here to support. And we have our clients. Our clients are there.
Right.
Some are able to walk. Some are going to just be sitting at some of the registration tables and showing their appreciation to you for helping them. So that's the major fundraiser, the Sickle Cell Walk.
Yes. I'm definitely going to try to participate in that this year.
It looks like there's another question. Let's see if we can get that pulled up. Let me see what pops up here so we can read it. It looks like it says, is there a link by sickle cell and the negativity of hemophilia?
There's a link.
Is there a link between sickle cell and RH negativity or hemophilia?
I'm personally not familiar.
I was going to say, I'm not familiar with the link. I don't believe there is a link, but medically, we can check it out with one of our physicians and just ask that question. So if they don't mind sending us those type of questions to our webpage, to our email, specifically email. It's just
Mhm.
sicklecellna.org. And I will receive that particular email, and therefore I can respond to it by speaking to one of our physicians about that.
Great.
And I don't think so.
Okay, great. Outstanding.
Does bone marrow transplant help with sickle cell?
I think we covered that, and she said that was one of your most successful cases when
Right.
you had a bone marrow transplant.
Yes.
So outstanding. So June 19th is National Sickle Cell Awareness, but actual Sickle Cell Awareness Month is in September.
Yes.
How did that come about? You know,
The national office, the National Sickle Cell Office, based out of Maryland, started the Sickle Cell Awareness Month in September. And the way the World Sickle Cell Day started was it was in a foreign country, and it was brought over to the United States, and that was in June. And we are all talking about that. We wish all of that was at the same time, but it's not. So we just move forward. We celebrate World Sickle Cell Day, June 19th. We celebrate Sickle Cell Awareness Month in September. And we do, at some churches, we do what we call Sickle Cell Sabbath Sunday. That means all the donations that you want to give to sickle cell is given during the month of September.
Right.
But it works well for some organizations and it doesn't work for others. So if you're participating in our walkathon and your church is participating, then we appreciate that type of support. And then we have those who don't want to participate in the walk, so they celebrate during the month of September. And we do health fairs, and I forgot to mention that. Anytime there's a health fair anywhere in the city, anywhere in the 10 counties we serve, we will be there to represent our office, to put up our display, to share the information that we have. So I want to at least let everybody know, contact us if you're having a health fair. We will be happy to come.
Yes. This is awesome. And team, again, for those of y'all who are out there and viewing this, please take time to share this live with somebody else who can use this vital information that Ms. Thompson has given us and given you all. I think it is outstanding, and this is stuff that we all should know and we should be educated on to ensure that we ourselves are doing the right things with our own bodies, and along with when we're going to start our family, ensuring that we're starting our family off on the right foot. And to my co-host, I appreciate you taking time to share the moments that you go through in dealing with your son and the things that you had to deal with, because I know it's a lot, and I've been there when you've been in the hospital and those late nights and those 24 hours, so I know it's hard. I know it's hard, and I appreciate you just taking that time to talk to us and to talk to the viewers about that, because sometimes people keep a lot of that personal.
Yes,
but, hey,
absolutely.
I applaud you for sharing and letting others know that, hey, we're not exempt. We're not exempt.
We are not exempt. Absolutely. Appreciate that, Charles. Thank you.
Yes, sir.
If anyone have any questions for me, I'm here at CNI Solutions most of the time. And hey, just reach out. I'll definitely share as well. But there was one of the things that you all do every year, you do a camp.
Yes, there is a sickle cell camp for children ages 7 to 18.
Okay.
We actually go to camp in Georgia.
Okay.
And we take anywhere from 1 to 5, however many wants to go. It's usually no more than 5 from my group that's there. But the camp is, it covers the entire state of Georgia, Alabama, and in the surrounding states. So the children are coming from everywhere. And what they do at the camp is they group you age-wise, and they have counselors, and many of the counselors are sickle cell clients themselves who have passed the age of 18.
Okay.
And then you have medical doctors, you have nurses on duty. So we have a full staff. You have a nutritionist there. Everything is covered. If you don't know how to swim when you go to camp, by the time the camp's over, you're swimming. If you haven't been kayaking, you can do that. You can just do whatever that. They have so much activities, and you're with children or adults or teenagers you're grouped together. So you make friends, lifetime friends at the camp. It's a beautiful experience, and I wish every child that wanted to go could go. The only thing that they come up with is once camp gets ready to get started, if you've been in the hospital 2 weeks before camp starts, they don't want you to come because you're not fully healed from whatever was taking place. So, but my campers have had such a wonderful time.
So how long is the camp normally?
It's a week.
Okay. What
And
time of year again?
It's on July. Always in July.
Ooh, nice and
And
warm.
so yes, it's beautiful. I go for the first day and I leave them. And then I'll come back and pick those up who need rides back home.
Right.
So, it's fun. And I like 2 boys. I took 2 brothers. They told me that was the best time they've ever had in their lives.
That's good.
All right. So we have another question that says, is there education available for children with the trait?
Yes, we have brochures. We have a couple of, in fact, we have some videos that are out. I need to get some of those. It's with children talking about sickle cell, how they handle it, everything. So it's information out there. We were in the process of getting new brochures. We've changed administration on the national level 3 times in the last 2 years. So all of the material is not available right now, but the state of Michigan, which is we call it the grandfather of sickle cell for the United States.
Oh, wow.
Dr. Sherney was one of the founding doctors in that area. Now his daughter is Dr. Sherney, and she's handling the state of Michigan. So they come up with all kinds of good stuff for us. So there are some good videos, and I need to call her tomorrow to see if she'll send me some of those. So if you're local, just contact us in the office. And when those videos come in, we'll be happy to share that information.
So what was that website again?
SickleCellNA.org.
Okay, SickleCellNA.org. Okay.
All right, and we'll make sure our producer puts that information in the chat for everyone if she has not already done that. Ms. Thompson, I can't tell you, this has been phenomenal. I enjoyed you. I enjoyed your presence. I enjoyed the information that you had for us. And I think it's so important that others really should know about this and govern themselves accordingly on that. Any closing remarks, ma'am?
Just want to say to many of our supporters, and I've been working with this since 2012, we thank you. We thank you for always supporting our clients. We thank you for participating when we reach out to you, especially during this last 2 years with COVID. I sent out letters and requests and asked them to support us because our clients' needs were still there. And I just want to say thank you for continuing your support.
Awesome.
Great. Awesome. Mr. Fondy, again, it's something that's such an importance to you and your family. Any closing remarks for the viewers or for Ms. Thompson?
Well, to the team all of the viewers out there, many thanks to you, Ms. Thompson. I really appreciate it. And that's why I brought my son. I want him to have firsthand information because this is his life to live.
Right.
And as much education that he can have about where he needs to go forward is super important. Because I'm one of those dads that I release you to your life. I don't plan on following you. He knows it. I get 18, maybe a little bit more years to. Did I hear something? Yeah, I get about that many years to encourage you to do the right thing, and I think that's a lot of years. So just be aware and be willing to give others awareness. And right now we say it all the time, like, share. And I think that's the least we can do at times because there's someone waiting on that information. Someone is out there waiting. We have a lot of great information that comes through our cast, and there's someone waiting. There's someone looking for you in order even just to encourage them, to say it's going to be okay. Life is a process. How many more minutes do I have? Okay, that's it. Okay, but really, life is a process, and just be willing to go through the process.
Yes.
All right, thank you. Hey, team, we appreciate all of you all for taking time to join us on tonight's cast. We really appreciate Ms. Thompson here giving us this vital information. Yes. All right, keep in mind, We do got an entrepreneur classes starting next month. For those who's looking to start their business and get into business, please sign up for that class, and we'll show you that, we'll make you a successful business owner. And as always, remember, your yesterday is not your today, and your today is not your tomorrow.